Namaste. Siddhi Pranam. Welcome to today's topic, which is understanding fertility treatment. The reason why we have covered this topic inside your module is for you to be aware of what it takes to be under a fertility treatment these days, and what all a woman's body goes through while being under a artificial fertility infertility treatment. And when she is getting medically treated for infertility, she has to go through a lot. Her body goes through a lot many changes. She's induced with so many different kinds of medications, and a lot happens during that phase. The purpose of this lesson is also for you to really understand that yoga can help in terms of bringing fertility to women, especially if they do not have worse underlying medical conditions, just certain lifestyle disorders such as PCOS, etc., which are the cause of infertility. Yoga and lifestyle change and diet change can certainly contribute to large extent, and they do not have to go through this if required. So the reason we are introducing you to this treatment and the level of artificial inductions, of different set of inductions the women's body goes through, is for you to understand that it may or may not be required at a certain stage. And if a woman student of yours is going through this, then where you need to take care. And also, if you wish to motivate women to get off the fertility treatment and focus just on alternative health transformational work such as yoga and diet change and lifestyle change otherwise, then also you should have enough information to know what it takes to be under an fertility treatment. So let's dive into the topic now. So fertility treatments are kind of medical interventions aimed at addressing the infertility, which is the inability to conceive after 12 months of regular unprotected sexual intercourse. So if it has been 12 months that the couple has been trying and have not been able to get pregnant, then they can consider themselves as having certain fertility issues. In that case, they can actually go and consult the medical practitioners. So infertility can actually result from various factors, including ovulatory dysfunction, male factor infertility, and tubal disorders. Like other health conditions, infertility can be treated using different approaches and improving the chances of pregnancy. So the choice of fertility treatment really depends on the factors such as underlying diagnosis, visibility, and the patient's preferences. And each treatment option carries its own risk, benefit, complications, cost, and also success rate is different in different treatments. And some of the major fertility treatments include medications, intrauterine inseminations, also known as IUI, and in vitro fertilization, which is also very, very commonly used, IVF. And then there are assisted reproductive technologies, and sometimes they might require surgery depending on their medical condition, and also using donor gametes. So gaining a deeper understanding on the anatomy, causes, and diagnosis of infertility can really help you understand this whole process more in depth and help your students if required. Now, let's discuss the causes of infertility. The majority of infertility cases, over 75% of them, have been identified. They do have identifiable reasons, so which can be addressed and that can improve the chances of conceiving. However, around about 15% of cases are usually classified as unexplained infertility, and infertility can be caused by various factors affecting either male or female. So male infertility can be attributed to low sperm count. In medical terms, it's called oligospermia, and also poor sperm motility at times. Sperm motility is the rate at which the sperm can try to enter the egg, and low sperm count is, of course, the number of sperms that are required in the semen of the men is not present, required number. And then, or abnormal sperm shape is also another reason for infertility. These factors can be result of testicular infections, certain surgery men had, or undescended testicles, or ejaculation blockages. And other medical conditions that can impact male fertility can include sometimes varicose veins, cystic fibrosis, chemotherapy, Cushing syndrome, diabetes, thyroid disorders, and certain medications like steroid or exposure to steroid in other manner. Maybe sometimes these days men induce steroids while working out for certain different reasons. So these are the reasons, not only the female fertility health, but men fertility health also has a great role to play in conception, because they both are partnering in that. So why you should be informed is because if a woman is struggling alone sometimes and you are aware that she's going through everything, then sometimes we need to focus on the male partner also. Just being informed will really help you in these kind of cases. Now, female infertility can also can be classified into three main categories basically. One is ovulatory dysfunction, and this is characterized by irregular menstruation cycle or absence of ovulation during the menstruation cycle. It's known as anovulation. So that means during the menstrual cycle, ovulation does not occur in the woman's body. So ovulatory dysfunction can be caused by conditions such as PCOS, polycystic ovarian syndrome, thyroid disorder, elevated prolactin level in the body, elevated androgens due to adrenal tumor, or PCOS also cause elevated androgens in the body. And hypothalamic amenorrhea caused by factors like being too underweight or doing excessive workout, or sometimes eating disorder also cause this kind of issues. Now, second one is tubal occlusion. So tubal infertility refers to the blockages or damage in the fallopian tubes which transport the egg from the ovaries to the uterus. Sometimes sexually transmitted disease, STD, or cervical dysplasia, or previous surgery, or some abdominal infections are also common causes of tubal ovulation. That means the blockage in the fallopian tube. Third one is uterine disorders, and there are conditions that affect the uterus. So major uterine disorders include endometriosis, growth of uterine lining cells outside the uterus. So endometrial poppins also is another reason, which is uterine tumor. So the uterus develops some kind of tumors that causes this condition. And congenital uterine malformation is another reason for this condition. Sometimes decline in the number or quality of eggs in the ovary due to the factors like age, surgery, chemotherapy, exposure to radiation in any manner can also significantly affect the female fertility. Lifestyle factors such as obesity, lack of exercise, genetic factors, and other secondary diseases like cancer, AIDS, tuberculosis, etc. can also influence the female fertility. Now, let's discuss about the diagnosis of infertility. So the underlying causes of infertility can be diagnosed using various methods. So couples who have been unable to conceive 1 year after of unprotected sex should actually, they consider infertility assessment. So women above 35 years of age should ideally, think of seeking medical consultation after 6 months of unprotected sex. So if she is trying hard and not being able to conceive while she's 35 or above, then she can actually consult the doctor after 6 months also. And in this case, early consultation is recommended for women with, women who has a history of irregular menstrual cycle. They should also ideally consider to go to the doctor prior to, just after 6 months of trying also. So infertility diagnosis in female, the initial examination for couple experiencing issues involves, assessing the regularity of menstrual cycle, which typically falls between 21 and 35 days, and women with irregular menstrual cycle may be evaluated for ovulatory dysfunction. And this can include, assessing thyroid hormone or prolactin or level of follicle-stimulating hormone, FSH in the body, production of LH, luteinizing hormone, and also estradiol levels in the body. So if the symptoms of polycystic ovarian syndrome are present during the clinical examination, and what is polycystic ovarian syndrome? Basically, in the polycystic ovarian syndromes, there is cyst-like particles that forms inside the ovary of the woman, and hence they cause many disturbance in the production of hormone levels, or the level of progesterone increases in the body overall, and that causes many different issues in the female body. And if this is present during the clinical examination, then sometimes, obesity, facial hairs growth, acne, or irregular menstrual cycle, testosterone analysis also further may be recommended, because these are the side effects or consequential effects of PCOS, polycystic ovarian syndrome. So if the ovulation history is unclear during the clinical examination, blood progesterone levels can be measured on the 21st day of the menstrual cycle. So if the progesterone levels are found to be lower than normal, it may indicate ovulatory infertility. And on the other hand, if the ovulatory dysfunction is ruled out, then further assessment may be done to evaluate the ovarian reserve. So there is a hormone called anti-Mullerian hormone, AMH, or through this, by checking the level of this hormone or through ultrasound, they can actually assess the ovarian reserve. So ovarian reserve is like the number of eggs in the female body, stored. So AMH is a protein secreted by the follicles of the oocyte or the egg, and provides an indication of the ovarian follicular pool size. So AMH along with FSH and estradiol can be assessed to estimate the ovarian reserve. So all these three hormones can be tested to determine the ovarian reserve. Now the next is tubal infertility, and to diagnose this, an X-ray of fallopian tubes is done, or a dye is introduced into the uterine cavity and observed for any blocks in the fallopian tubes with the help of a keyhole surgery. So this helps to identify any obstructions and scars and examine the uterine inner lining, which is endometrium. Transvaginal ultrasound done through the vaginal canal is very common diagnostic tool used to assess the anatomy of the uterus. So sometimes, depending on the condition of the women, the medical procedure does vary. Depending on specific circumstances of the female. Now, infertility diagnosis in the male, infertility factors can usually primarily be examined through semen analysis, which determines the semen value and the sperm production. And a semen analysis also assesses the sperm motility and the shape deformity. Also, additionally, further blood tests can be conducted to assess the testosterone and follicle stimulating hormone and FSH level in the male. Ultrasound can be used to examine the ejaculatory ducts for an observation or growth. So once again, this also varies based on different male and their different kind of medical history also. Now, next is fertility treatment advancement. So with the advancement in the medical research and technology, fertility treatments have become more successful compared to past decades, and it offers higher chances of successful pregnancy these days. The choice of fertility treatment is really based on underlying fertility issues and the clinical evaluation conducted by the doctor. And each treatment option has its own success rate, risk, and the cost. And so the patients usually need to assess very, very carefully and keep in mind multiple factors when they, choose to select the treatment. Now, very crucial point of what kind of medications a woman's body goes through whenever she opts for a certain kind of fertility treatment. So the medications are the first line of treatment to address the infertility caused by ovulatory dysfunction. And these drugs work in different ways to stimulate or regulate the hormonal secretions required for the development and the maturation of follicles. So it's crucial to take these medications only under, whenever, they have been only prescribed by the doctors. And I'm really hoping that women don't induce these kind of pills without any prescriptions, because otherwise it can be highly risky for women's overall health. So these medications are really sensitive and their dosage really varies from women to women, and because it has a lot of side effects associated with them. The first one, which is commonly used, is metformin. Usually it's given to control the blood glucose level in diabetes, and it is also given to women with polycystic ovarian syndrome for weight loss and to reduce insulin resistance in the body. Next medicine that's commonly used is dopamine agonist, and commonly used, this drug is commonly used in this category. There are famous drugs like bromocriptine and cabergoline. These drugs, they actually decrease the high level of prolactin and induce ovulation. So high level of prolactin level causes anovulation, which is the absence of the ovulation. And dopamine agonists are typically taken for 10 to 12 months, and ovulation is usually restored after 6 months of the treatment. The next medicine that is usually induced is clomiphene citrate. Clomiphene citrates produce the secretion of hormones that helps in the development and maturation of ovarian follicles and promotes ovulation once again. Another medicine is letrozole, which increases the secretion of hormones to aid ovulation also. But this one has adverse effects such as hot flashes, headaches, fatigues, and sometimes can cause multiple pregnancy also. Another commonly used one is gonadotropins. Gonadotropins consist of two hormones, which is FSH and luteinizing hormone LH, and these hormones induce ovulation. So the basic job of gonadotropins, it's typically recommended as a second line of drugs if the woman's body is unresponsive to clomiphene or letrozole treatment. And once again, they are introduced through injections mostly, and with requirement of constant blood hormonal level monitoring. And with this also, there's higher chance of multiple pregnancy, and this treatment can cost a lot also. Now, all this medication does have certain side effects, but which is usually explained to women since we are playing with natural hormonal levels through a chemical through inducing artificial chemicals in the body. So next is understanding the intrauterine insemination, which is another treatment done, and this is a procedure that falls under artificial insemination. In cases of male infertility, IUI or intrauterine insemination is one of the first line treatment approaches, and it involves directly placing collected sperm into the uterus during ovulation. And IUI combined with medication-induced ovarian stimulation is a recommended treatment approach for unexplained infertility. And this procedure is typically performed 24 hours to 36 hours after inducing ovarian stimulation. So IUI ensures the availability of sperm and enhances the chances of fertilization. The success rate of IUI has been found to be like 5 to 15%. So the success rate is actually lower than that of what is most commonly used treatment is IVF and other invasive reproductive methods also. Similar to other treatment methods, the success rates of IUI tends to decrease with increasing age. If the patient is aged, then this treatment method does not work that much for them. Next is assisted reproductive technologies. So ART or assisted reproductive technologies are a preferred approach for addressing infertility in individuals who have been unsuccessful in achieving the pregnancy through natural means, and medication also does not work for them, or they have tried other techniques also but they did not work. So ART basically encompasses procedure that involves manipulation of eggs or embryos to facilitate pregnancy. So it is an umbrella term that includes a range of advanced fertility treatments, including IVF, in vitro fertilization, and also intracytoplasmic sperm injection, which is ICSI, as well as techniques such as there is this technique called GIFT, gamete intrafallopian transfer, or zygote intrafallopian transfer, and also frozen embryo transfer. So there are different medical procedures, you can say, or I would say laboratory processes. Some women choose to freeze their eggs these days if they are aging, and they later on when they are ready to be pregnant, they want that frozen eggs to be used. So artificial reproductive technology that also comes under this. Sometimes males' sperms are not at all viable. So in that case also these kind of technologies are used. So there are different scenarios in which this help can be taken from these kind of advanced reproductive technologies. Now the next is in vitro fertilization, and this is a widely used medical procedure for treating infertility, and it involves the fertilization of sperm and egg in a controlled environment outside the body, followed by the transfer of the resulting embryo in the uterus. So IVF is commonly recommended for various infertility issues, including, if the woman has tubal infertility, that means she has blockage in her fallopian tube for some reason. Then in that way they introduce the embryo into the vagina through the vaginal canal into the uterus from the vaginal route, rather than which is the natural route is going through the tube. But if the tube has blockage, then this is the way they do it. Now, male factor infertility and advanced maternal age, if the woman is quite aged, and or if they have any unexplained infertility issue, that in those cases also IVF is an option. So different techniques can be employed in IVF. Techniques are named as embryo transfer, which is called IVF-ET. Then there is gamete intrafallopian transfer, GIFT. This we discussed in the art also. And then there is zygote transfer. There is frozen embryo transfer here also. So among these technology, the IVF-ET, the intravitreal fertility embryo transfer, is the most commonly performed in 99% cases. However, IVF is contraindicated for patients with heart failure or pulmonary hypertension. So, IVF process actually consists of several steps. Number one being controlled ovarian stimulation. So first step is that they induce women's body with medication to stimulate the ovarian, stimulate the ovulation process. And most of such medicines have, hormonal, chemically induced hormones, and they are used to stimulate the development and maturation of the follicles. They also require to monitor the level of estradiol in the body, which helps to see how much the female body is responding to the induction of the hormones in the body. The second usually used is GnRH agonist cycle, which is human the SCG hormone is used to promote the maturation of egg in the female body. That is also done as part of one process. Now there is another way. The GnRH hormone is also used sometimes as it's called GnRH antagonist cycle, is used to protect the mature egg in the body. So that is also induced in the female body. Now oocyte retrieval is also one method where an oocyte or the egg is retrieved from a follicular fluid using either the laparoscopic technique or an ultrasound guided transvaginal approach. The next is fertilization. So the retrieved egg or sperm and the sperm are mixed in a controlled environment outside the body to facilitate the fertilization. In cases of male infertility, sperm injection is also recommended or given to the male, and where single sperm is directly injected into the egg of the mother. And before implantation, the fertilized egg of embryo may undergo to pre-implantation genetic testing to screen the genetic and chromosomal abnormalities. Then the embryo transfer occurs. So the embryo is transferred directly to the uterus once formed fully in the tube. And in cases of with abnormalities in the uterus, alternative procedures such as gamete intrafallopian transfer, which is GIFT, or zygote intrafallopian transfer, ZIFT, or pleuronucleal stage tubal transfer, PROST, may be performed using laparoscopic techniques. Typically, the day 5, which is the blastocyst stage, or the day 3, which is the cleavage stage of pregnancy, embryos are transferred to the uterus. Only one embryo is transferred, while the remaining embryos can be preserved for the future use. So, which can simplify, the further subsequent IVF procedure in case the pregnancy doesn't occur in the first or other attempt. Then the next step is to support the implantation and maintain the pregnancy. So once they have successfully introduced the embryo to the uterus, and uterus has accepted the embryo, in that case they need to induce women's body with hormone medications to maintain appropriate levels of progesterone and estrogen in the body. And the success rate of IVF decreases if the woman is aging. For the women aged 35 and above, the success rates range from 52% to 7%. And the success rate of sperm injection for the male are similar to IVF results in the male donors, in the male also. Now, the next way of fertility treatment is donor gametes. So, in cases where the intended parents are unable to produce viable eggs or sperm, so external assistance can be taken. So, donor eggs or sperms, donor sperms, or embryos can be utilized as a solution. Depending on the specific fertility concern, either a donor sperm or a donor egg or a donor embryo is used. And this approach really allows the couple to have a biological child, albeit with genetic characteristics of the donor. Now, let's discuss the risk in assisted reproductive technologies. So, like any other treatments, art are not risk-free, of course, and there are major challenges. Commonly known challenges are like multiple pregnancies, and this represents primary risk associated with the infertility treatment, particularly in context of IVF. The likelihood of multiple pregnancies, such as twins or triplets, are more considerably higher in IVF treatment, and as a result, there is increased probability of experiencing premature labor, which poses a lot of health risk for the babies and mother also. Prematurely born infants are particularly vulnerable to health complications, and that is why babies are one of the kind of risk associated with IVF pregnancies and deliveries also. So, ovarian hyperstimulation syndrome, OHSS, this is another risk associated with the ART, and this represents another frequent complication kind of associated with infertility treatment. Particularly, this is prevalent among women with polycystic ovarian syndrome or PCOS who are undergoing the fertility treatment. So this stimulation of the ovaries, so what happens is when the woman's body is being induced with certain hormones and treatments of IVF, the stimulation of ovaries during these treatments can lead to increased production of eggs, resulting in swelling and painful enlargement of the ovary. However, these days doctors do have improved technologies and they try their best to do careful treatments and have protocols at place such that the occurrence of ovarian hyperstimulation syndromes is decreased, and the risk can be minimized, but this risk still exists. Now, there are emotional and psychological considerations to be taken when somebody is taking artificial assistance for fertility. So, when a woman is undergoing an infertility treatment, she can encounter various psychological, emotional challenges that can really have a profound effect on her mental health and quality of life and overall well-being also. And most women going through IVF treatments, majority of them, especially when they have continuous failures in being able to conceive, they go through large amount of frustration, depression, anxiety, sense of hopelessness, feeling of guilt, and sense of worthlessness also comes to them most often. And they are vulnerable, and henceforth, they really require special attention, counseling, support at this stage. Mental health support really has to be given for the women who are undergoing fertility treatment, by whoever is on their side, and especially by their healthcare providers. That is their first and foremost formality or responsibility. So if they are in your touch and your students are going through this, then it also becomes your responsibility to keep helping them with your alternative health tools that you have in terms of yoga, meditation, etc., to help them deal with this anxiety and depression that they go through IVF treatment. So, it has now kind of become mandatory in the IVF center to have a mental health care provider and to provide psychological and emotional support to the couples that are undergoing the infertility treatment. Next is ethical and legal considerations. So, though IVF has advanced from ethical and legal point of view, but artificial reproductive technology still raises multiple concerns, and it is just not limited to a traditional couple. Since now, unpartnered women or homosexual couples can also have a biological child. So method involving sperm and egg donation or gestational carriers or surrogate mothering can give rise to children who are not biologically related to one another or both parents, or may not be carried to a term by her own mother. So this raises a major critical ethical consideration. And conversely, like techniques like insemination with the husband's sperm and in vitro fertilization IVF, which results in children biologically related to both parents, are carried to the term by the mothers, are expected to generate fewer ethical concerns. But these days, things are different, society is changing, and many a times we need to see how much we are pushing nature beyond our own limits and understanding. So henceforth, the ethical and legal consideration changes with choice of infertility treatment method, the law associated with IVF in the country, and specific region as well as religion sometimes, and the society and the way of considering this also matter. Usually when there is donation, they involve either donation of egg or sperm, then donors usually ask for confidentiality to be maintained, and that also is part of this treatment and ethical consideration. And these days there are certain practices where in vitro development embryos are even planted in non-human entities for research purposes, and which is actually strictly prohibited inside So all this is kind of medical advancement that are happening. Though it's not directly related to this topic, but just I thought to add this information to you for you to understand where science is going and how much we are playing with our own bodies and with the body of other beings around us. So let's see, can really complementary and alternative medicine, which is yoga, yogic practices, or can these contribute in the treatment? So alternative and complementary treatments are actually very commonly sought thing by people who are going through infertility treatment or kind of fertility health issues. So this can usually include people looking for yoga classes or pelvic physical therapy or hypnosis, homeotherapy, spiritual healing, acupuncture, herbal therapy. And so while these traditional practices contribute to overall well-being and their success rate in treating infertilities really have not been studied because they vary so much, but among various complementary treatments, acupuncture does have a research where in the context of fertility treatment, and it has demonstrated the potential of improving fertility without increasing the risk of multiple pregnancies. And acupuncture treatment specifically targets and regulates the hypothalamic, ovarian, and uterine functions that play a vital role in achieving pregnancy. And similarly, the practice of yoga has also shown in reducing the level of stress, and it can have a very positive impact on fertility. And yoga does not only help elevate pain, depression, and anxiety, but also lowers the incidence of assisted vaginal delivery while improving the fetal outcomes. So, yogic practices also helps to detoxify the body. It also enhances the overall vitality of the mother and the father, and it promotes a sense of well-being and increases the blood supply to the uterus and the ovaries, which is paramount in terms of functionality of the reproductive organ. So by really improving the physiological and psychological state of couple, yoga really has the power in overcoming infertility and enhancing the chances of successfully either they can act as complementing to the assisted reproductive treatments that the couple is already going through, or if they have not opted for it for a while, let's say about 6 months or 1 year, they can try to focus on working just on their health and lifestyle through complementary methods that might include yoga, yogic lifestyle, diet changes, acupuncture, etc., to really support their fertility health as a couple. So it's really important for us to know that that these alternative treatments or like complementary practices does have potential benefits, and they do also have success at times, but it really varies. And also in many cases there is a lot of research required still to scientifically prove that they are more effective than whatever scientific treatments currently available. So sometimes if the body is in such a condition, then fertility treatments are required, but still, even if the yogic practices are used as complementary, they can still help in increasing the overall vitality and enhancing integration between mind and body, and it can that way help address the fertility issues. And anyhow, each fertility treatment is tailor designed for specific needs of the patients. So each patient has different issues which may or may not be directly addressed through yoga practices or other complementary practices, but we can certainly merge and bridge them together to bring the best results possible. With that, I hope this helped you, and we really hope that we are naturally able to foster a healthier world and decrease the amount of fertility issues in the world by providing yogic lifestyle, the beautiful gift of ancient technologies and health practices that our masters and gurus have given us over the centuries, and use them in the benefit of humanity, such that we do not have to opt for unnatural processes annually. But if you do encounter patients, students, or women or male that are going through this process, then I really hope this information help you understand your condition, both mental, physical condition, and emotional condition, that you can help them and be by their side in a more efficient way. With that, thank you and